Hello, Ms. Phillips.
Hello.
Hi, I'm Dr. Maglia. I'm one of the psychiatrists. Thank you for coming and seeing me today. I can see you seem a bit concerned about your blood results, which I've come to talk to you about, and discuss the options of managing it. Before I begin, can you tell me what your concerns are?
Yeah, well, since they upped the dose of my risperidone, I've sort of seemed to have this problem where I'm leaking sort of milk, and I just wonder if there's anything we can do, like different medication or something, just try and sort this out, because I just find it really embarrassing to deal with.
Yeah, I can see, Ms. Phillips, you seem really uncomfortable.
Yeah.
I can assure you it is something that I do see, and we are able to manage it. So another medication is something we can discuss later on.
Right.
But I need to ask you a few more questions in order to confirm that it is a side effect of the medication or not.
Okay.
Is that okay with you?
Yeah.
So you said they increased your risperidone, and since they increased it, how long ago was that?
It was 2 months ago.
Okay.
Yeah.
And what's the dosage now?
It's 8 milligrams now. 6 before.
And why did they increase it?
I started to hear some voices, so they thought it would help if I had an increase.
And your diagnosis is?
Yeah, schizophrenia.
Okay, and how are the voices?
That's going to be alright, but then I've just been there for this, so it's not working for me.
Okay, and when did the leakage of the breast start?
It's about 4 or 5 weeks ago.
And is it in both breasts?
Yeah, both, yeah.
How much of milk is coming out?
It feels like a lot. I'm using breast pads, I'm having to change them through the day. I'm wearing big jumpers, I'm worried, sitting there covering myself up, so it feels like quite a lot.
Is there anything else coming out apart from breast milk?
No, just the milk.
Okay, I can see it's really difficult for you. Has this affected your periods at all?
Yeah, I haven't had a period for the last 2 months. It's increased the dose of the tablets.
Is there any chance you could be pregnant?
No, I haven't got a partner at the moment, so no, absolutely not.
Okay. Any other changes in your weight?
No.
Appetite?
No.
Sleep?
No.
Okay. Any headaches?
No.
And any problems in your joints or your bones?
No.
So no arthritis or any other?
No, just this.
Okay. Any visual problems?
No.
Okay. So, Ms. Phillips, what you've told me is that since your medication was increased, you started to have leakage of your breasts, but the voices that were troubling you have stopped.
Yeah, that's right. Yeah.
Okay, and you've not had your periods as well.
That's right.
Okay. Are you on any other medication apart from the risperidone?
No.
Okay. And how has this affected your mood?
Just, I feel embarrassed all the time. Don't want to go out. I just feel really self-conscious. So not that great, to be honest.
Yeah, I can see this is quite difficult for you and uncomfortable. From what you've told me and from the results that I've seen, your blood results, your prolactin level is raised. Do you know anything about prolactin level?
No.
Okay. If I can explain to you, usually when moms give birth, they usually have lactation, so the breast milk gets produced. And that's the prolactin hormone in our body, which actually causes the production of milk.
Right.
Yeah.
Okay.
Yeah. So what has happened is that your prolactin in the blood has increased, and usually risperidone is one of the medications which does cause an increase in prolactin level. Yeah, I'm not sure if they told you about this when you started risperidone, but it is a common side effect, and we usually advise patients when they go on it that this is a possibility.
Okay. They might have said, but I don't remember.
Yeah, are you following me so far?
Yeah, that makes sense. Yeah.
So we do have some treatment options.
Right.
So what we can do is reduce your risperidone, and also consider another medication like aripiprazole, which has less chance of increase in prolactin.
Okay.
Is that something that you would like us to do?
Yes, please, definitely. Yeah.
Yeah, and obviously at the moment it's uncomfortable for you. I would suggest that you need to continue using breast pads.
Okay.
But we will need to also monitor your blood level, so we'll have to do regular blood tests.
Okay.
Yeah. The other thing is, obviously, once we reduce your risperidone and switch you over to the new medication, there'll be a period of you not having treatment where there's a possibility you can become unwell.
Okay.
So there's a chance that you might hear voices or have any symptoms,
Right.
like when you've relapsed in the past.
Okay.
Okay.
Yeah.
I know it's a lot I've told you, but I can give you a leaflet so you can have a read more about aripiprazole
Okay.
and about the hyperprolactinemia, which I've just explained to you.
Yeah. So if I stop the risperidone, that should just like automatically stop the milk.
Usually when we reduce it and we'll repeat the blood test, we'll see that the level will go down.
Okay.
So there's a good chance that it'll reduce, and that's what we find with most of our patients.
Fine.
Ms. Phillips, if I could just summarize what we've discussed, is that you've had a raised prolactin in your blood, and that's possibly due to a side effect of the risperidone. And I understand how uncomfortable and distressing it is for you, but we will be changing you to another medication like aripiprazole, which has a less chance of causing this.
Okay.
Yeah. Thank you for talking to me today.
Okay, thank you.